Well, lest any of us thought this pandemic was entering its final stages, the World Health Organization says it's now recorded the highest rise in coronavirus cases since this pandemic began. On Sunday, 183,000 people around the world were confirmed to have COVID-19. The global total of confirmed cases, well, that's now past 9 million. Interestingly, though, this is what the WHO has said on whether these rising infection numbers mean that some countries shouldn't now ease their lockdowns.
Some countries that have successfully suppressed transmission are now seeing an upswing in cases as they reopen their societies and economies. All countries are facing a delicate balance between protecting their people while minimizing the social and economic damage. It's not a choice between lives and livelihoods. Countries can do both.
Well, the country with the most infections is the United States. 120,000 people have lost their lives. The number of infections there went up by more than 36,000 just on Sunday. The total is over 2.2 million. As you may know, the infection rate in New York was very high. It was the center of the US outbreak, but that rate is now falling and the city's starting to reopen. Unfortunately, the news is not so good in the south and west of the US. Florida and Arizona, for example, recorded their highest increase in infections over the weekend. And these states, as you can see in these graphs, now seem to be on a similar trajectory to the ones we saw in the northeast of the US through April and May. The most important headline figure, arguably, is that while infections fell in the US in May, they are now rising again in June. Well, to find out more about these rising numbers of infections in some US states, here's Anthony Zerka in Washington.
It seems to be surging in states that have been easing off their shelter-in-place restrictions and allowing businesses to reopen. So places like Texas and Florida and California and Arizona. I mean, it is interesting that these are a lot of southern states, but then again, those were states that weren't hit the hardest early on. New York obviously has seen their cases decline, but that's because they had a high number of cases initially. So I think what you're seeing is people are beginning to stop wearing masks, beginning to start socializing again, beginning to go out to businesses again, and as a result, the virus cases are starting to go back up again.
And can we map how the different states have eased their lockdowns next to their politics? Is there a correlation there?
Well, you know, like I mentioned, California is one of the cases, one of the states that has seen a rise in cases. California is a entirely Democratic-controlled state. Meanwhile, Arizona, Texas, Florida, they're controlled by Republicans. So, you know, much more of a relationship between the decisions to ease off on these business closure and shelter-in-place orders rather than the politics of the individual states in question. You know, if you look at Arizona, which is showing one of the largest spikes, they did not have any mask restrictions. They didn't. They began opening very early on. The governor of Arizona just announced last week that he was going to let local officials start to make decisions about whether to require masks in public and whether businesses should be able to continue to have more and more people come in. But when you have local governments doing that, then you could have a kind of a patchwork of response throughout the state, and that is going to be unlikely to be able to arrest the growth of the virus at this point. Gottlieb, who is a former FDA head, he came out and said, looking at Arizona in particular, said that we could reach the point here in that state soon where these kind of gentle mitigation efforts like mask wearing aren't going to be enough. You're seeing hospitalizations go up, you're beginning to see people put on ventilators, the numbers going up, and then it's only a matter of time when death rates start to go up.
Now, let's switch from the US to Brazil, because there more than 50,000 people have died from COVID-19 and the number of new cases continues to rise. Brazil recorded more than 54,000 new infections on Sunday and its total is past 1 million. And given its low testing rate, that figure could be considerably higher. Even so, President Bolsonaro remains committed to the reopening of his economy. Our correspondent Katie Watson has more on this from Sao Paulo.
Metido de uma gripezinha It was just a little cold, said Brazil's president, when the crisis started. And even as the infection soared and the death toll climbed, Jair Bolsonaro carried on. I'm no gravedigger, he quipped in April as he was questioned over the numbers. A week later, he was taken to task again. So what, he answered, I'm no miracle worker. As the situation worsens, the president continues to focus on reopening the economy and says little to ease the pain of those who've lost loved ones.
Brazil's hit 2 more grim milestones in a matter of days. More than 1 million cases and more than 50,000 people dead. But not even these numbers are prompting the president to change course. In the middle of a pandemic, many Brazilians feel they're lacking leadership, and the numbers keep going up and up.
Now, next I want to look elsewhere in Latin America. In Peru, new infections continue to increase, more than 3,500 on Sunday. The overall total is past 250,000, and Peru has the highest rate of infection after Brazil. If you factor in Chile and Ecuador as well, all four, well, 20 to 25 people out of every 100,000 of the population have died because of COVID-19. Mexico's just behind that with an average of 15 to 20 out of every 100,000. The infection rate there is rising too, even though just under half of all the states there are still in what's called the red zone, under the highest alert. That means bars and cinemas are closed, sporting events are cancelled and so on. Well, here's one of the BBC's Latin America correspondents, Will Grant, on why the number of infections in Mexico continues to go up.
Somebody I was speaking to, a Mexican analyst this weekend, said to me, in a sense, normal life is carrying on. I think what quite a few of those countries you've mentioned in your list there have in common is their high levels of poverty, their very rural populations and their very sparse populations too, and obviously great poverty in their urban centres as well. And for a lot of those people, not working, staying at home, locking down with your family simply can mean not eating. So we're seeing, for example, the rates in Peru that we saw, the problems in Mexico that you say are sort of right hot on the heels behind of Brazil, are partly, I believe, coming from the fact that people are still going out to work in various forms. A friend of mine in Tijuana, for example, on the border with the US, said really lockdown here hasn't been respected at all. So I do think that is a big part of the problem.
Let me also ask you about Cuba, Will, because there's a country having a lot more success in controlling the virus. I guess it has a geographical head start on many countries.
It does. That's part of it. It acted very early, but also, it has a lot of experience in dealing with infectious diseases. It's very proud of its record on things like Zika and its medical system in general. And of course, on some of those things like ordering lockdown, because of the fact it's obviously a police state and run by an autocratic government, if they say don't step outside, or when you step outside you must wear a face mask, people are doing it because obviously there are serious consequences to not doing so. So it's obviously being followed through on a lot more harshly, but it is absolutely having a much better effect. They had 3 infections in the past 24 hours and just 2 deaths out of the past 18 days. So Cuba is absolutely on top of the problem.